Hi, Nurse Sherry here, and today we're going to be going over how to apply a gait belt. So a few things that you need to know about a gait belt is making sure that you apply it properly and making sure that when you do have it around the patient that there's only 2 fingers worth of space between the gait belt and the patient, because as they stand, things will flatten out and you'll have more space, and the last thing you want is for it to slip upwards, okay? So it's very important to make sure you have this on correctly. So if I was going to go into a patient's room, I would wash my hands, knock on the door, enter the room, introduce myself, and identify my patient. So, hi, my name is Sherry. Can you verify your name, please?
Aubrey.
Aubrey, nice to meet you. I'm going to be your CNA today, and my name is Sherry, and I'm just going to apply a gait belt. Would that be okay with you? Okay, perfect. All right, so I'm going to take this, and the first thing I do is look at where this mouthpiece is and the teeth of the gait belt are, and then I know that that's where I'm wanting to put the end in, because sometimes this tag is on the inside and sometimes it's on the outside. So I'm going to place it around the patient, about right under the rib area in the mid-abdomen, and I'm going to go through this mouth, and then the teeth are here, and then I'm going to just kind of go this up till I get close to the skin. Then, can I have you raise this hand? I just want to be able to show you guys. When I grab right here, I go straight back. And you can see how that tightened it. And now I have 2 fingers worth. Then I just need to move this a little bit because I don't want it on the side where my hand is, because I don't want it to cut my hand. And I also don't want it on the belly button navel area because I don't want it to cut that either. You want to make sure that a patient always has clothing or a gown that is completely covered before you apply a gait belt. Another good question they may ask you on the written exam for CNAs will be, how do you position your hands? They're going to be in an upward position. So if it did feel loose, I still have a hold of it. If I grabbed like this, my hands could just slip out of there and then the patient could fall. So you're going to have your hands like to the back on the side, so that I'm actually getting all the use out of the gait belt that I can. I do tell them that it's going to be a little snug when I place it. I try not to use the word tight. All right, and that's how you apply a gait belt. Thank you for watching.